Hong Kong has reported 80 new coronavirus infections, mostly local transmissions. It's the second day in a row that cases are below 100. 3 new deaths have been recorded. The city is now dealing with more than 3,600 infections.
现在我们最重要的是香港的市民要增加防疫的意识，包括减少公众聚会，保持社交距离，注重个人卫生。大家一定要谨记，市民的健康是最重要的。
Authorities have extended social distancing rules by another week, including a ban on gatherings of more than 2 people. All residents must also continue to wear masks in public. Healthcare personnel from China have been deployed to Hong Kong. They'll help with virus testing and will build hospitals. A temporary field hospital has just opened, and 2 more are due to in the works. As Roland Lim reports, Hong Kong authorities are bracing for the worst.
Hall 1 of the Asia World Expo has been converted into a makeshift hospital with 500 beds. Located next to the Hong Kong International Airport, the Asia World Expo Centre usually hosts international trade fairs and international acts. They've all dried up since the start of the year. Now it only plays host to patients with mild symptoms. On arrival, they go through x-rays as well as blood, saliva and heart tests. If found unstable, they're sent to hospitals, while the stable ones stay on.
Because the patients are relatively stable, and you can tell the patients can have the vital sign to be checked by themselves, and also they will have the medication that will be prescribed on day basis, that the patient will take the medications by themselves as well. So the workload will be less for the doctors.
This would allow for only a couple of doctors and a dozen nurses to be on duty at any one time. At full capacity, 14 doctors and 45 nurses will help run the treatment centre on rotation. The government is also planning to build a temporary hospital from scratch to complement the Asia World Expo facility. This will add another 2,400 hospital beds to ease the current shortage at public hospitals. Another makeshift hospital, possibly at Kai Tak, the former airport site near the Hong Kong Children's Hospital, is also being discussed. A team of 7 mainland medical experts, a pilot group among 60, has also been sent over to help with the planning and construction of the facilities and the preparation of a temporary laboratory to help raise virus testing capabilities. Yu Do-wen, leader of the team and a member of Guangdong's Province Health Commission, is confident of increasing the city's testing capacity to 200,000 tests a day from the current 20 to 30,000. Meantime, there are still over 150 people who've tested positive still waiting for hospital beds. The hospital authority says it's not an ideal situation, but added that the situation is improving.
Many of the elderly people are now ready for discharge. They're able to generate the antibody, and they're actually turning negative in terms of the viral load. So gradually, I think the elderly people who are actually admitted very early on in this outbreak, they are gradually able to return to the elderly homes or back home.
After 12 consecutive days of over 100 cases each day, Monday and Tuesday has seen the number fall to 80 plus cases. But health officials are still cautious, urging residents not to lower their guard. Now, the current safe distancing measures in place by the government has been extended by another week and is likely to be extended for a few more weeks until the latest wave is under control. The beginning of the new school term at the end of this month will also be without face-to-face classes for fear of cross-infections between families and making contact tracing complicated. Online lessons will be conducted instead. Hong Kong's third wave in July was due to some cases brought in by the tens of thousands of people who were exempted from a mandatory quarantine imposed on most arrivals. Roland Lim, CNA, Hong Kong.